Mr. Nolan, you can start.
Thank you very much. Good evening and welcome to the New York City Health and Hospitals Fiscal Year 2021 Virtual Annual Public Meeting for the Borough of Bronx. Good evening, everyone. Before we start the formal program, I'd like to call to your attention that we have interpretation services. If you require these services, please call 212-788-3359. I'll repeat that number, 212-788-3359 for interpretation services in Spanish. My name is Bob Nolan. I'm the Bronx Borough Rep representing the City Council delegation on the Board of Directors. I want to thank you for joining us and would like to introduce you to other board members who are here tonight. First, the chair of our board, Mr. Jose Pagan. Second, I'm not sure if he's arrived yet, but he will arrive at some point. Dr. Mitchell Katz, the President and CEO of our Health and Hospitals. 3, we will be joined by Barbara Lowe, the Manhattan representative to the board. And we are joined by Frida Wang, a board member, as well as the Bronx's own Sally Hernandez Pinheiro. Thank you very much, my colleagues, for joining us. Also on the panel is our Senior Vice President and General Counsel, and she will be the moderator for this evening, Andrea Cohn. And Kalisha Hercules down here as Secretary of the Corporation. Believe me, she does a lot more. She's the Chief of Staff, and I've spent 45 minutes telling you all the other things she does to keep us together, pull us together, and make sure the Health and Hospitals functions on a regular basis. Thank you so much, Kalisha. On behalf of the board, I'd like to extend our thanks and acknowledge our facility, who's the CEO at Jacoby, and also now North Central Bronx, which is a division within Jacoby, as well as Christopher Roca, who is the CEO at Lincoln. So welcome to both Christophers, Mr. Roca and Mr. Mastromano. Thank you for joining our meeting this evening, and a dedicated staff for providing exemplary service to our public health system and the people that we serve. And all of you who are here, thank you for your support as we strive to provide equal access to safe, affordable, quality care to all. I am prepared to turn this over to Dr. Katz Kalisha, but unless I do not, is he on the meeting at this time?
I'm here. I hear
a voice. I hear a voice there, so I am delighted to turn the microphone over to the President and CEO, Dr. Mitchell Katz, for his remarks.
Thank you, Bob, and thank you for being such a great board member and representative of Bronx.
You're welcome.
Your experience in the Bronx is always of great help to us.
Thank you.
What's hard to believe as we watch New York City joyfully reopening, that it was just a little more than a year ago that we were in the worst part of the COVID pandemic, that our emergency rooms and ICUs were full of people who were struggling to breathe, that we were losing friends, co-workers, family members, children lost their parents. It was a horrible, horrible time. And I want to thank all the members of Health and Hospitals who did everything they could to save life, to care for people, to hold their hand as they passed into the other world, to comfort, to bring iPads as well as medications so that people could communicate with their family. We're very proud of Health and Hospital staff because while other systems that had to withstand similar types of overrun of patients in Wuhan, in Italy, our system never crumbled. We never turned anybody away. In fact, we took care of people from other hospitals where the other hospital was not able to provide that care. So I think our staff, our nurses, our doctors, all of the support staff, our pharmacists and respiratory therapists, all deserve so much credit and so much gratitude for what they did. New Yorkers responded generously through the Helping Healers Heal program to provide $35 million in donations so that we could provide our staff meals, remembering, again, the horrors of last March. We were asking people to work 12 hours, 16 hours in heavy PPE. And not only was there no time to go out for food, but there wasn't any place to get the food because all the restaurants were closed because of COVID. So it was a horrible time. The money helped to pay for transportation because the subway wasn't running late at night, clean scrubs because people feared going home in the same clothing that they worked in, hotel accommodations because people worried about infecting family members, childcare. The dollars that New Yorkers and others across the country generously gave made us able to get through those horrible, horrible times. When cases began to decrease, we were able then to launch the largest test and trace effort in the US, which I know saved countless lives as we were able to test people, tell them when they needed to isolate themselves from their family. At the peak, we were running 5 hotels filled with people who were successfully isolating from their families. We walked people's dogs. We went to pick up their medications. We got them food. We did everything that was necessary to enable people to safely isolate themselves. And then in our most recent incarnation, we're all about vaccinating. And it's that vaccination effort that has brought the cheer back to New York. People are once again able to hug, hang out in the same room, and share lunch together because people are vaccinated. And Health and Hospitals has had a very special role in doing that because overwhelmingly we care for the immigrant populations, the uninsured, the Black and brown communities, people who may be a little bit more frightened of getting vaccination, may know that we're the ones where there is a nurse who can explain in their language why it's safe to get vaccination. And we want to be the leads in vaccinating our population. We're doing our centers of excellence in Bronx, Brooklyn, and Queens to care for people who have symptoms long after their initial infection with COVID. We're working to make sure that the inequities that were further exposed during the pandemic don't persist, but are narrowed by providing great primary care and reaching out to people where they are to be their primary care provider and their connector to health, whether we're talking about a life-threatening illness like COVID, or we're talking about a kid who needs a vaccination. We want to be able to do all of those things for the people that we care for. Thank you for being here tonight. Your presence shows your support of this public hospital system. The main purpose of today's meeting is for us to hear from you, members of the community. Your input is so important to the future success of this program. We're ready to listen thoughtfully. I'm going to turn over the podium now to our General Counsel, Andy Cohen, to outline how the meeting will work. Thank you all again for being part of the Health and Hospital family.
Thanks so much, Dr. Katz. Before I move into some overview of the rules for tonight, I just want to mention 2 things. First, if anyone joined us recently, I want to remind the rest of you and tell the people who just joined that we have language translation services available in Spanish. And if you would like to avail yourselves of these services, translation services, call 212-788-3359. I also just want to update the list of board members or designees who are on the call tonight and thank them so much for participating. Dr. Michelle Morse is representing Dr. Dave Chaxey, the Commissioner of the Department of Health and Mental Hygiene, and Philip Wadley is on representing Deputy Mayor Melanie Hartzog. So thanks very much to both of you for being on. So due to the COVID-19 public gathering restrictions, which continue at this point, we are convening the 2021 public hearing for the Borough of the Bronx virtually. This meeting is the fourth in a series of 5 meetings that are conducted annually across the city's 5 boroughs. The purpose of the annual meeting in each borough is to inform the public on the programs and plans of New York City Health and Hospitals, which you just heard from Dr. Katz, as well as to give the public an opportunity to present oral or written testimony concerning New York City Health and Hospitals performance. All kinds of testimony, both oral and written, will be transcribed and forwarded to all the members of the board of directors for their consideration. We have many members with us tonight, but any who aren't will receive the full package of testimony. And ultimately, there will be a summary of comments and a response on the Health and Hospitals website in the months ahead, consolidating them all from all of the meetings. You still have an opportunity to register to testify this evening. You can call 212-788-3359 until 6:30 p.m. That's the deadline for registering to speak.
Good evening, Andy. It's Barbara Lowe. I'm on the phone.
Oh, terrific. Hi, Ms. Lowe. Very nice to see you. That's Barbara Lowe, a board member. So just a quick note on the rules for testimony. The most important thing to understand is that this is an opportunity for the public to communicate to the board of directors, but not to engage in a dialogue. It's not a question and answer forum. You will make your comments and the board is here to listen. We have established that all registered speakers are allotted 5 minutes of speaking time. On your screen, usually in the corner while you're speaking, you'll see an electronic timer that will provide warnings about the expiration of your time. There's an example of the timer. It will be green when you first start speaking. A yellow light will indicate that you have 2 minutes remaining on your time. A red light means that the time is expired, and in a few seconds it will start to flash, which means you really have to wrap up your comments if you have not already, and I will interrupt you at that point and ask you to conclude your remarks. If you don't complete your comments within the allotted time and you have a written statement that constitutes your full remarks, you can absolutely submit them. You can call the same number I've mentioned a few times, 212-788-3359, and make arrangements to submit your full written statement into the record. And with that, I will note, I will do my very best. I have a list of speakers in front of me. Sometimes I haven't seen the names before. Sometimes I have. If I mispronounce your name, please forgive me and correct me at the start of your comments. Thanks so much for your participation, and we are looking forward to hearing from all of you. And with that, we will begin with our first presenter of the evening, who is Esme Satar-Lowe, who is the chair of the Community Advisory Board for NCB, North Central Bronx. And Esme, if you could hit *6 to get yourself off of mute, that will allow you to begin your comments. Great, thank you. We hear you now.
Okay, good evening, everyone. Dr. Katz and entire staff at H&H. My name is Esme Satar-Lowe, the CAP chair at North Central Bronx Hospital. Thank you so much for this opportunity to give you the input about NCB. Myself, my family, our patients over 39 years. I'm happy to inform you that North Central Bronx CAB has expanded its advocacy role by participating in their leadership as a CAB member. NCB continue to provide quality care to generate a family in the future. I have been advocating in my community, sharing with the vaccine that is available to North Central Bronx. I happen to have 19 patients, friends and family to take it, which I'm so happy about it. I want to thank you for everything that you are doing. And on behalf of the CAP members, working with Mr. Christopher Mastromano, we decided to work diligently to get things going. Thank you so much, and God bless.
Great. Thank you so much for your comments. Our next speaker is Roland Lopez. He is the chair of the Community Advisory Board for Lincoln. And again, if you could *6, that will allow us to hear you.
He's still
Hello,
Great, we hear-
do you hear me?
We hear you now. Yes,
Okay,
no, we
thank
do.
you. I'd like to say good evening to Bob Nolan and the board of directors, Dr. Katz, staff, all the CEOs of our institutions, chairs and speakers. I'd like to say that I live in the catchment area of Lincoln. Lincoln has always been a beacon here in the South Bronx. Unfortunately, we are number 62 of all the counties in New York State, but we're working hard, and Lincoln has always done a good job. And with the COVID, I think it has the CEO, the prior CEO, and Mr. Roca now, a liaison. They're doing an excellent job. And I know I haven't allotted time, so I'm going to speak on what I think is the most important issues. And one of them has to do with rat infestation, and we have raccoons. And we have also Pascual Gomez, which he'll speak on that later on. He's a neighbor, and he's a sergeant at arms of Lincoln. A long-time problem that we have here in the Bronx, especially in Hunts Point, is the pesticide spraying of carcinogenic pesticides that they don't use in other states, and they don't really notify us, not even in bilingual, and they spray so that they could control the West Nile virus. So we've had a couple of meetings with the community board, which I also belong to, but I'll go on. We have a problem with homelessness, which this leads to mental illness and at times crime. And we know that this equals negative health outcomes. And if that wasn't enough, we have climate change, which has hit us. And we also have chemtrails. We're only 12 miles from LaGuardia Airport. So that has, with asthma, we're a poster child for asthma, for cancer, what have you. Then we go on to gentrification now, that people are being displaced, and this has a mental impact. But Lincoln is there with a very good supportive psychiatric department, and they're doing a good job. Then we have financial institutions that are coming into the community, adding to the problem, and the trucks that are, some are green, but they add to the problem with the air because they're going to the terminal markets. And then we have a problem with seniors. Lincoln has been working with the seniors, and as we speak, we're all aging, so I hope that we're doing as well as possible. And the last problem that I'll touch upon is the undocumented immigrants from all over Central America, different parts of Africa, and Lincoln has done a good job of dealing with them and showing them that they belong to the community. So let me see if I have anything else. I think I'll leave it at that. Thank you. Hello?
Wonderful. Thank you so much for your comments.
Okay.
Thank you.
Thank you. Bye.
Bye-bye. Our next speaker is Zena Twyman, a Community Advisory Board member from Jacoby. Again, *6, please, to unmute yourself.
Yeah, can you hear me now?
Yes.
Okay, good. My first comment is, of course, with the vaccine. I had the Pfizer done at Jacoby in the end of January, and it was wonderful. I'm not afraid of needles, but I do want to mention the nurse that gave it to me. She was from oncology, and words cannot describe how pleasant she was. We had like a very good rapport. She came from the islands. I come from England, so we had something in common. We had a little laugh and everything. I had no adverse reaction from the shot. A little ache and pain and everything, but otherwise everything was done like really great. It was like really wonderful, and so was the second one too. My other comment is from Albany legislation for Lobby Day. We used to go up until I think about 3 years ago to Albany to see the legislators for Lobby Day and to get funding. Then people said, oh, it was a long day, and they didn't want to go up. And we had the bus there, from Jacoby, and I have been going up for many, many years. My husband was on the board until 2004 when he passed away, and I was invited to go up with him and accompany him and everything. So then I went up since 2004, and I also go up with AARP as an advocate. And I think it's very important that we do continue this because of the funding, and they get to know us, and it's different from seeing the legislators down here. It's a different process. So this is something that I'd like to see continue again in the future. And if anybody has any comments on that, I'd be pleased to hear that. And thank you for my participation. And I be very happy to comment again in the future. Thank you.
Thank you very much for your comments. Our next speaker is Al D'Angelo, a CAB member, Community Advisory Board member, also from Jacoby. And again, just remind you to use *6.
Good evening. I want to thank HHC for convening this meeting. It's nice to be able to hear from the public. As chair of Community Board 11 and also president of the Morris Bar Community Association, as soon as I heard that the vaccine was going to be offered to adults over the age of 75, I contacted Chris Mastromano at the Jacoby Medical Center and asked him how I can make this easier for those of us that are over 75, because working the computer is not always it comes with a challenge once you reach a certain age. And also getting on the phone, people are having a really hard time trying to get through to anybody to get their appointments. Chris put me in charge or in touch with Juanita Perez, one of his staff members. And what I did was I contacted every pastor I could think of, every community leader, and I reached out to everyone I knew and asked them to send me the names, phone numbers, and date of birth of anybody that fits that category. And what I did was I emailed them to Juanita Perez. Juanita Perez, then her staff called and set up appointments for each and every one of the people that I sent them. They did it within a day or two. I couldn't be more proud of being a CAB member than I have been. You know, every cloud has a silver lining. Well, COVID had this silver lining. Jacoby Medical Center came up so big. People that went there that never went to a city hospital before came back, called me up, thanked me, praised the staff. They couldn't thank and they couldn't be more appreciative of the service that they were rendered. They couldn't believe that people were so nice. Many people have a preconceived notion of city hospitals. This blew that out of the water because everyone, not one complaint. Everyone praised the staff, how polite, how courteous, and we were able to get so many of our elderly vaccinated where otherwise they would have given up. So I want to thank Chris Mastromano. I want to thank Juanita Perez and her staff. They did an outstanding job. It was just, they've just become part of the community. And many people who didn't have a good feeling about city hospitals had a whole new idea and a whole new vision of what city hospitals are all about. We have other hospitals in the area, and they paled in their efforts to what Jacoby Medical Center has done. Now, on the other note, since I have more time left, one of the things I think that our city hospitals have to do more of, and I know they do some, but they have to do more outreach. As you know, the Bronx is the least educated, the least healthy, the least, and the poorest borough of the five. We need to reach out and go out to the communities and check on people with asthma, diabetes, so we can catch these diseases in the infancy before they become full blown, and there's nothing that can be done but hospitalization and a quality of life that's not, not conducive to our community. So I would just, we have associations all across our neighborhoods. If possibly the hospitals could reach out to those organizations and bring a van or bring even just an educational series that comes in with either mental health, nutrition, asthma, diabetes, all the things that plague our communities, and just educate us in what we can do and how we can go about getting help for our communities. Because usually people that are least educated are fearful of talking to, excuse me, but big shots. They're not going to call a hospital and demand things where those that have a little more education know how to work the system. They need people to go out and basically hand feed them into getting help. And I know, Jacoby has been great as far as community, part of this community. And I just want to thank them. And I just want to hope that more outreach can be done in the future. But again, thank you for convening this meeting. And again, thank you, Jacoby. You've done a great job. I'm done.
Great. Thank you so much for your comments. We
You're very
appreciate
welcome.
them. Thank you. Our next speaker is Pascual Gomez, also a Community Advisory Board member from Lincoln.
Yes, good evening. Yeah,
Great, thank you.
yeah. I'm like Mr. Lopez said, I'm very concerned about the health thing in the Bronx, especially we being 62 in the state. One of the things that bothers me is that we have a huge rat infestation in the Bronx, unfortunately, and this affects a lot of the people who live here, especially the elderly and children. Another thing is we need to stop. They're putting these pesticides, and it's not just in the air, but it goes on the ground, and where kids play in the parks and everything, and that affects them. That affects them. It's very bad for them to happen. And another thing we're having with Lincoln right now is we are about to, a lot of us are about to end our tenure at that, and they haven't had anything so far to get. We need more people to join our CAB, who joins in the community. And there's a lot of people that have told me they want to join, and yet we've been unable to get in because I don't know what's happening. Why they're not interviewing and they're not talking to them for interviewing. And some of them are even patients at Lincoln who have very good things to say about Lincoln Hospital. And I think we need to somehow we need to get these people on our cabs, especially Lincoln right now. And one other thing is, like Mr. Lopez said, remember we have a large thing with trucks coming in, and which is the carbon monoxide, where the carbon that affects a lot of the community in terms of the asthma and this something. And I think we need to do an outreach. For instance, we need to do something where the hospitals go out in the community and have something, something similar to what the police department is. The police department has what you call National Night Out. I think the health and hospital need to do the same thing. Get people know how important health is. Okay, and I think it's very, 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 very important. I mean, and that's about one of the things I just want to say. Yeah, that's my spoke. Okay, thank you. Hear me?
Thank you yes, thank you very much. Appreciate your comments. Okay, so we have actually reached the end of our speakers list. We're right at 6:30, a little bit past 6:30, so I guess we don't have any others who are registering. I want to thank everybody who participated for listening in and making insightful comments. And everybody have a good evening. Thank you.
Thank you. Good night, everybody. Thanks for being part of it.
Usually the Bronx is a little more boisterous.